longevity of the people are increasing, so certain disease conditions, in arthritic conditions, they are increasing. And for that, till now, we have got certain medicines. Probably we all are coming up with an innovative medicine. Before I start that talk, let's talk about the different types of arthritis. Basically, they are the chronic inflammatory arthritis or rheumatoid and osteoarthritis. They have got a disease burden, pathophysiology, current options and the limitations and role of. Now coming to the rheumatoid arthritis, there is nothing much to say in front of such an august audience. But if we run quickly, we find that it is a systemic disorder characterized by chronic inflammatory polyarthritis of unknown etiology. The inflammatory state also involves skin, eyes, lungs and blood vessels. Fluctuating clinical course and unpredictable prognosis. It is associated with 60% risk in the CVD related death. It has got a complex and multifocal pathogenesis. Rheumatoid arthritis gets activated by antigen presenting cells and T cells. There is a release of inflammatory cytokinins from macrophages, tumor necrosing factor alpha and IL-1. These factors, they lead to synovitis, production of collagenase, leading to destruction of extracellular matrix and release of matrix metalloproteins, MMPs. This chart shows how they are acting. Tumor necrosing factor alpha and interleukin-1 are the major cytokinins involved in the pathogenesis of osteoarthritis. Apart from tumor necrosing factor alpha and interleukin-1, elevated level of IL-6, IL-17 and MMP have also been shown to be implicated in osteoarthritis. If we see how does these cytokinins they work and then how they damage the cartilage and how this osteoarthritis takes place. The pathophysiology of rheumatoid and osteoarthritis are tumor necrosing factor alpha and IL-1. They release these inflammatory cytokinins which are regulated by nuclear factor kappa, NF-κB. NF-κB is transcription of the factor represented in cells. NF-κB plays an essential role in the inflammatory and immune responses. Tumor necrosing factor alpha and IL-1 are the major inflammatory cytokinins involved in rheumatoid arthritis as well as osteoarthritis. These inflammatory cytokinins, they are regulated by nuclear factor kappa, NF-κB. This is a transcription of the factors present in all cells. They play an essential role in inflammatory and immune responses. They act as a master switch to turn the inflammation on and off in the body. They cause disorders due to NF-κB activation in rheumatoid arthritis, osteoarthritis, ankylosing spondylitis, psoriatic arthritis and juvenile rheumatoid arthritis. NF-κB is the master switch of inflammation. Now coming how this NF-κB gets activated. Inactive NF-κB is present in the cells. There is inflammatory stimuli by tumor necrosing factor and interleukin-1. They release the NF kinase and NF-κB gets active. Then they are translocated in the nucleus. There is activation of genes encoding inflammatory mediators. They produce pro-inflammatory cytokinins, TNF, IL-1, IL-6. Then there is inducible enzymes which cause release of inflammatory mediators. The synovial membrane is affected. There is inflammation, proliferation of synovicites, there is a pannus formation. Chondrocytes, there is increased in the activity of COX-2 and MMPs. They produce destruction of the chondrocytes, the cartilage gets destroyed. Later on, there is osteoclastogenesis of bone erosion. These NF-κB plays a crucial role in the inflammatory and immune responses through the regulation of the genes, encoding pro-inflammatory cytokinins and inducible enzymes. Now, Kerala Pharma, they have come out with an innovative option for the management of arthritis. This product is supposed to be NF-κB inhibited. The drug is curcumin diferylyl methane. This is a biological active phytochemical compound obtained from the rhizomes of Curcuma longa, that is haldi. They produce different diverse properties which have got anti-inflammatory, antioxidants. 65 clinical trials with more than 1,000 patients have been done, and research is still going on 35 case trial series. Curcumin is an NF-κB inhibitor which controls inflammation. It has got multiple sites of action. It prevents activation of NF-κB inhibiting IKB kinase, which prevents translocation of inactive NF-κB and active NF-κB into the nucleus, and prevents release of the inflammatory mediators. There are certain evidence-based reports. There is a comparative study of curcumin with diclofenac. They show that curcumin competes very well and is effective and safe in the patients with osteoarthritis. There is a pilot study where patients were treated for 2 weeks, which is effective and well tolerated in the treatment of rheumatoid arthritis. A real-life experience with curcumin monotherapy. Curcumin relieves pain and reduces the need of NSAIDs in osteoarthritis. You remember our olden days when while playing football or cricket we used to fall down and our mother used to say, "Doodh mein haldi dal ke pee lo." There is a comparative study of curcumin with ibuprofen, where say curcumin is effective as NSAIDs, but it has got better GI tolerance. It significantly decreases the WOMAC, pain, stiffness and functional score from baseline in both groups. Curcumin is effective and safe for the long-term management of osteoarthritis. Curcumin, when combined with NSAIDs, provides additional benefits. It is when given with celecoxib, enhances the action of celecoxib in COX-2, decreases the need of celecoxib. When given in combination with prednisolone, provides additive inflammatory action through inhibition of inflammatory cytokinins. There is a significant reduction in joint swelling, a reduction in side effects due to steroids. Probably the dosage of steroid also may be reduced. And when it is administered with methotrexate, it has got a synergistic anti-arthritic action which may reduce the dosage of methotrexate. Thus, it reduces the dosage of hepatotoxicity and hematological toxicity. Unlike NSAIDs, steroids and DMRDs, curcumin is well tolerated. So, it is the introduction of a novel formulation of curcumin. There is a need for a bioavailable, effective and well tolerated curcumin formation. This is how it acts. There is a self-micro-emulsifying drug delivery system. NSME-DDS has been developed, and the technology provides nano-sized hydrophilic droplets of curcumin, which has got an improved absorption and better tissue penetration. This ensures higher bioavailability, and this is a bio-enhanced drug dosage. The exact dosage may vary from patient to patient depending upon the disease severity, degree of inflammation and patient response. Majority of the patients with mild to moderate inflammation usually respond to 100 to 200 milligrams per day. If required, the dosage can be increased up to 400 milligrams per day. To summarize, it inhibits the master switch of inflammation, decreases the release of inflammatory prostaglandin and cytokinins. Monotherapy found to be effective and safe in the treatment of rheumatoid and osteoarthritis. Efficacy at par with NSAIDs with better GI tolerability. It can be used with NSAIDs, steroids, and provides additive synergistic action. Thus, it helps in reducing their dosage. It can be used along with methotrexate. It helps and reduces the risk of hepatotoxicity. Unlike biologics, it can be given orally. It is safe and well tolerated. It is a suitable option for monotherapy as well as in combination therapy. It is effective, safe and well tolerated treatment option, especially in the patients who are intolerant to NSAIDs, who have got a compromised renal function, hepatic dysfunction is there, and cardiovascular disorders like CHF or hypertension is there. Let's make life free and pain free, that's their thing.